So if you were doing medial and tibial nerve evoked potential studies, I would mark CP3 and CP4 on the head, which I'm not going to do right now because I think I have a picture of it. And then I would ask the patient to roll over on their side. And then, don't suffocate yourself, sweetheart. And then I would ask her to scrunch her head down. And I would find C7. Can you see it close? And then I would count up 2. And I could find C5. And I would place an electrode on C5 right here. And then I would go down to the bottom of the rib cage and find T12 and come back and mark T12 and put an electrode here. And then I would find the iliac crest right here and put an electrode here on the iliac crest. On these two, I would also put a stress knot, which would just loop over and tape the stress knot. On these kind of tests, tape is your best friend. So as much tape as you want to use is good. Down here, on the popliteal, sorry, sweetie, I would go 2 centimeters up to use the first electrode, and then 3 up from that to use the second, or I could go on the side to use the second electrode. And then I would ask the patient to move over. For the lower SSEP, I would put the ground electrode here, or the ground here, and for the upper, I would put it here. For the Herb's point, for Lily, the hairs go in deep, but for a normal patient, I would ask her to scrunch up. Can you scrunch up for me? Here. And then you can see in here, right in here is where you find it. And for these electrodes too, when you get the surface ready, you want to, after you cleanse the surface, you want to take a wipe and wipe it off so that the electrode makes better contact with the skin. And then after you have all your electrodes applied, you want to apply your stimulus. So let's pretend, just for now because we're not in the lab, that this is a stimulus. And the part with the cord is the anode. And you want to have the patient make a fist, like this, make a fist. A little bit harder. In between, a little bit harder. And then you see the 2, a little bit harder. And then put it towards you. And you see how those pop up? So you want to put the stimulus 2 centimeters up from the wrist. And the anode portion is the red portion. And you want to put that pointing away from her head. And I would tape this down. You can stop making fish now. And then I would make sure everything's connected, make sure that my impedances are lower than 0.5K ohms. And then I would slowly turn up the stimulus. And then when she has a twitch, go ahead and make a twitch. Twitch. I would ask the patient if that's okay. Is that bearable?
Yes.
Keep twitching. And then I would let that go for a little while to make sure that that I'm not getting too many rejections. And then I would start the test. Can you pause it for a